Radio, cultivating mature positivity, the People Station.
CMPradio.net. We are live. We are live for our Telethon fundraiser that we're doing today for Delco Gives Day. You still have until 7 p.m. to donate to the local organizations, the local nonprofits. Right now, we are sitting down with Miss Sue from ChesPenn. How are you today?
I'm doing very well. Thank you so much. Thanks for having us.
Yes, thank you for coming. So I'm going to ask you a few questions. So the first question I have for you is, can you tell us about the mission of your organization and the key issues you're addressing in the community?
So the mission of ChesPenn is to provide comprehensive, quality healthcare services to the community of Chester, regardless of their race, ethnicity, their ability to pay. So we've always been in the community. We're going on now 51 years.
51?
51 proud, blessed years.
Wow.
Yes.
And what's your title there?
I'm the president and CEO.
Oh, nice. Yes.
I started at ChesPenn in 1983 as a dental assistant. Then office manager, billing manager, practice administrator.
Oh, that's awesome.
Director of operations, COO, now president and CEO.
Oh, it's nice.
It's been a wonderful journey.
I can believe it. What specific programs or projects are you currently working on, and how do they benefit the local community?
Well, right now, we've been working on with American Cancer Society, doing cancer screenings, breast cancer screenings, cervical cancer screenings. We're also working with Million Hearts for hypertension, to prevent prenatal patients post and prenatal, so that we're working with that, and we also work with Keystone First blood pressure program.
Now, do y'all do these screenings inside the office in Chester?
Yes. So we have the two offices in Delaware County. There's one in 125 Southeast, 125 East 9th Street, and then 5 South State Road in Upper Darby.
Okay.
And we do both. We do all those services at both locations. The only thing that's different from the Chester office is that we also have dental services at the Chester office.
Okay. Okay, that's good. Because listen, ladies, because y'all know I be sending y'all, I'm a breast cancer survivor.
Okay.
So I've been telling a lot of my friends, go and get your breast screenings. Cancer doesn't have a face on it.
No, it doesn't.
So definitely go get checked, check your boobies. I usually do a program. I did my first one last year for breast cancer month.
Okay.
Awareness month. And, that's my way of giving back for what I went through. So it's good that y'all are doing that there. And is it free?
With ChesPenn Health Services, we see people regardless of their ability to pay.
Okay.
So it's based on a sliding fee. So if you have very little income, it's a graduated thing. But if you don't have the money, like for the lowest thing, it's based on the federally qualified, the poverty guidelines.
Okay.
So it can start anywhere from $0 to $10 to $12. So, and if the person doesn't have it, then we don't, it's not a barrier. We're not doing anything that's a barrier to care. We don't do that.
Oh, wow. That's good.
Yeah.
That is awesome. Listen, ladies, go there, and men,
Yes.
go and get your screening.
Yes, as we do the
very
prostate
important.
cancer screenings, the colonoscopy, not a colonoscopy, but we'll do the FIT test for the colon cancer screenings. We have STD screenings. You can, everything else you have to have an appointment for.
Okay.
But the STD, you can walk in to get a same-day appointment.
Okay, that's awesome. How has your organization adapted to recent challenges such as the COVID-19 pandemic?
That's a very good question, and I'm glad you asked. It is one of the things I feel like the FQHCs do an excellent job of. No matter what the situation is or the current climate, even though we've never experienced anything as drastic as the COVID-19 pandemic, we was able to pivot, and we started doing virtual visits. We still had in-office visits. We was doing COVID-19 testing in our parking lot. We did COVID-19 testing with the city of Chester. And then we end up getting a mobile unit. So we did that on location at the 125 East 9th Street office.
Okay.
So we still, right now, even though we're fully back in the office, we also are doing a hybrid model. So if some people still can't come into the office, we still have some virtual and majority are in-office visits. But we just kept it moving, and we started doing virtual visits. That's what was one of the things that kept us going through the pandemics. Because initially, virtual visits were never allowed as a billable service through Medicare. But when the pandemic hit, they waived all of that, and so we was able to pivot and continue to see patients.
Yeah, they have to be able to adapt to what's going on, because you never know. Yeah. Like the pandemic literally shut the whole world down in a matter of a couple days. It was like everybody's out moving around, and then next minute, boom, everything is just a ghost town.
Yeah, and that's one of the things I was really proud of our staff, because even though we all had our own fears, because you had COVID, it was like you got a death sentence. Yeah. And we still came to work. And I was so proud of the staff, but they still came to work. We was masked up, everything, but they still came, despite their fears of getting COVID, they still came out. So I'm really,
awesome.
Really proud of them for that.
Yeah. Can you share a memorable success story that occurred because of your organization's efforts?
Wow. That's interesting, because we had just celebrated our 50th anniversary, and we did what did he call it? Like when you do like a documentary of where we were to where we are currently, we are now.
Yep.
And we've had one of the stories. There was a young lady who actually came to ChesPenn as a child. Okay. And then she was so impressed with the care that she received there, and then our founder at that time was Dr. Yagnick. and she loved the way Dr. Yeti took care of her, and she ended up going to school to be a physician, and now she is a physician.
Oh, that's awesome.
So, and then we had another story of a gentleman who lost his tooth, and he couldn't afford to get it done, replaced anyplace else. So he came to ChesPenn. He had us all in tears because by the time he was telling us his story and how happy he was, and now he found a new dental home. He has a beautiful smile now. So that was the two ones that I remember distinctly. One was they actually went into the medical field, and then another one they was able to get their smile back. So that was excellent.
Yeah. How does that make you feel? Like seeing them go through that?
It's one of those things like it was heartbreaking that somebody had to go through that and then to be told no, and then for them, there's a lot of people I found they don't know about ChesPenn, and they say, oh, we thought you might have been a place for HIV, or we thought you were a free clinic, whereas we're not. We're just a regular doctor's office. But the only thing I think that stands out for ChesPenn is that if you go to a regular doctor's office, you're going to go to your doctor's office, you're going to have your visit, and they're going to say, okay, take this and go somewhere, find out if you can get your food, or if you can find out if you need help with your electricity. At ChesPenn, we have those enabling services. So if you need help with your electricity, we have people to help you with that.
Wow.
If you lost your insurance, we have people to help you with that. If you need directions for the services for food or whatever your need is, we just don't say, okay, good luck with that. Here's your next appointment. We have people to offer those services to the patients.
Oh, that's awesome. I didn't know that y'all did that. Because,
Yes.
I work in Carol Kazim's office, and people are always looking for services, and y'all right down the street.
Right down the street, right in the neighborhood. And we've been in Chester for, like I said, going on 51 years now. Wow. We started out at Ninth, and I can tell you another funny story. When my family moved to Chester, it was in 1974.
Okay.
And then in 1979, I had a daughter, and I received a card in the mail about coming to have her lead tested, and so I put her in a stroller. We going down the street, and it was on 7th and Tillman, and coming from the city, brick and mortar, you go to a building. And when I got down to 7th and Tillman, it was a trailer. And it wasn't hooked up to nothing. I'm like, I don't think so. And come to find out, it was legitimate. And it was ChesPenn. It was Children's Clinic of Chester and vicinity. And they were seeing they began because it was a high lead pandemic in Chester.
Okay.
So she started with that. And that's why I received the card in the mail for the lead.
Oh, okay.
And then I'm like, then years later, here I am, sitting as their president and CEO of ChesPenn Health Services, and I wouldn't even go through the door the first time because it didn't look reputable.
It's like, wait. So I'm supposed to get my daughter help here in this trailer? No.
And one of I think too, is another misgiving. Some of the patients or the people in our community think we're not real doctors, because we heard that a couple of times too. All of our doctors are board certified.
Oh,
so we have internal medicine, OBGYN, pediatrics, nurse, physician assistants. Everybody is board certified. No, we don't have anyone I don't know when they was referred to a real doctor, but we all are real doctors.
Oh, that's awesome. Y'all hear that? Y'all better go to ChesPenn. Stop playing this right around the corner. What does Delco Gives Day mean for your organization, and how do you plan to utilize the funds raised?
What Delco Gives, it means a lot because for years, community health centers never, ever did any fundraising. That was something that was really frowned upon. People just thought, okay, you're already a nonprofit, you're receiving federal funds. And how it works is that even though you receive federal funds, it's only a small part. Then we're required to have collaborations with other organizations to do the breast cancer screenings.
Okay.
And so we never ventured out and did any fundraising. This is our first attempt at that,
Okay.
and we found that we need to do that now because there's not enough funding, and we learned that through the pandemic.
Yes.
Once all the prices and all the everything that's raised, all of our costs have gone up. Salary, people are demanding higher salaries now, and one of the things that we find it hard to compete with is with the private sector because they can offer those higher dollars.
Mm-hmm.
So what we're going to be using our funds for is to continue our process of making services available to patients who don't have that ability to pay. So we'll use those funds to offset that cost.
Okay, that's awesome. How can individuals get involved with your organization beyond donating money?
Beyond donating money, because right now, what we're looking into is for the longest time as well, we could not have volunteers.
Okay.
Because it has to do with your insurance and how many employees you have.
Okay.
Earlier in the day, before we was under 50 employees, we was free as a bird. We didn't have any restrictions. We didn't have to follow any guidelines. But once we hit that 51st employee, and now we're up to 100, we have insurance issues. So we can't have volunteers. But people can make donations. We have another program was baby bundles.
Okay.
Where all the people with all our new moms receive diapers, nose aspirators, bottles, Pampers, as something to help bridge them until they can get their, or even as a supplemental for what they already have. So if they want to donate to that program or to just general operating funds, that'd be great. But right now we're actually looking into what we need to do for volunteers.
Okay. And have y'all been able to get, like, so y'all can't get interns either, like from the universities around?
Right. So we collaborating right now with Widener University to have their nursing students. We also working with IBC.
Okay.
And we've worked with them in years past, and they'll have nurses come to the site so they want to do rotations in public health.
Okay.
And we're working with Widener as well as they have a nurse practitioner program. They have the nursing program, there's social services, there's social workers. So we're working with them for them to come and do that. Right now, we're working with Crozier Hospital for their residency program.
Okay.
So, and that's at our Upper Darby office. That makes that office really unique because the residents go through that office. And so you have family medicine, internal medicine, it doesn't matter. They all run through that office. And then at the East Side office, we have the residency program for the OBGYN.
Oh, okay, that's great. How does your organization ensure transparency and accountability to your donors and community?
That's one thing. I'm really grateful that we have always been transparent. And it wasn't like something that you have to say, okay, we have to do this because this is what the guideline says. We've always been transparent, and anybody can come in and ask to look at our books, and because it's always been something I think too. It's been a requirement of the federal government ever since we received the federal funds. We are scrutinized, I think, more highly because we do receive the federal funds.
Okay.
So it's never been an issue, thank God, in ChesPenn's 51 years history. So we're very open.
Oh, that's awesome. What are some of the biggest challenges your organization faces right now, and how are you working to overcome them?
The biggest challenge we have right now is workforce. And that's due because after the pandemic, a lot of our physicians retired, behaviorists retired, or they wanted to go work virtually. But our model is to be in the office. We've had med techs, nurses, front desk staff, you name it. People go on to other organizations like New Morris or CHOP because they are a healthcare system, and then they can compete with those salaries. And that's one of the things that we've been, and I just came back from Harrisburg today, because I was there Tuesday and Wednesday. We was lobbying, going to meeting our senators, our Congress people, so that we can say, look, we need funding, we need your support to just, health centers never, ever, ever had a line item in the budget. So we're saying, health centers is a documented fact that we have saved over $14 billion into the healthcare system, keeping people from out of the ER, the emergency room, and we were asking, like, about a $14 million, we're saving you $14 million. Can you give us a $10 million line in the budget? So we were asking for that. So that's one of the challenges we're trying to come up with, so then that way we can have additional funding on a regular basis.
Yeah, that's definitely needed.
And we're also starting an MA training program. So any of our staff who like say if they work at the front desk and they want to become an MA. So what we found out is, like, a lot of people that go to MA training schools, the cost is so high that once they come out of school and they get a job, they're not making enough money to pay off their student loan. So we started a program through a funding that we received as well to offer that training to our staff. Okay. And that's going to be our pilot program, because once we transition out of that, we open it up to the public. So if anybody in our community, any of our patients want to pursue a field as a medical assistant, we can do that as well. So that's one of the challenges we're trying to face with the workforce.
So when are y'all starting that program?
That program is going to start. If they probably looking at me going, Sue, it started already. If it hasn't started, it'll be starting by the end of this month, and it starts with our. We have 5 of our staff. We have, I think, 3 of our front desk staff, and then 2 of the other current medical assistants. They're going for their certification.
Okay, and then how many? Once the pilot is done, how many people will you take for training?
I do believe we're going to be taking up to 10.
Okay.
So we can have some at, and what is going to, we're starting right now at the East Side office, but it will be available for, once we roll it out, it'll be available for the people in our Arbor Darby office, the Chester office, and our Coatesville office.
Okay. Looking ahead, what are the key goals for your organization in the next year, and how can Delco Gives Day help achieve them?
Well, we're looking right now to expand our services to different things that are really our patients' needs. Because right now, if you're a diabetic and you need your foot care, we have to send you to someplace else. So right now, we're looking to hire podiatry, bring that in the office. We're looking also to bring in chiropractic services, because people have a lot of neck pain, headaches, could be from migraines, back pain. So that's one of the other additional things we're doing. So we're looking also to bring in dietary. Okay. That'll help patients with their diabetics, and then obesity. So those are the things that we're looking for to bring those additional services on. I think one of our major challenges is, and using our funding for, is to supplement the high cost of care, the maintenance for EMR, which is electronic medical record, cybersecurity. Those are the things that we've never had to have before, but now we are mandated to have those things. And it's expected, because that's the way the world is going now.
Absolutely.
But the cost for cybersecurity
is expensive.
It's in the millions of dollars. I'm like, you want a FQHC, a community health center, to try to pay for that? So I would say that was one of the major challenges. And if funding from Delco gives, we would definitely put it towards that expense, because it's very expensive to try to keep everybody's information private as it should be.
Yes. Yeah, and like you said, the way that the world is going and during the pandemic, it forced everybody onto a computer.
Yes.
Or a laptop or a MacBook, or an iPad or your cell phone.
Yes.
To be able to communicate. But it also left it to where, people are able to hack into your stuff. So a lot of the organizations, they're doing that for protection.
Yes.
For the patients and for honestly themselves. You figure if somebody's information gets out there, they want to sue you guys for, their information for a breach. And,
Yeah, so I think that's, if I had to think of any one project, I would say cybersecurity.
Okay. And then is there anything else you want to tell the people that are watching? How to donate to ChesPenn or...
Yeah, so if you want to donate to ChesPenn, we're on Facebook. We are on LinkedIn, not LinkedIn. The other one is Facebook and Instagram. Thank you.
Instagram.
So we have those two accounts. You can go on ChesPenn's website. You can donate there as well. We also have on ChesPenn's website careers and what opportunities we have for open positions. So if you're looking for a job as an MA or we need physicians, check us out. And ChesPenn is a great place to work. Everybody, every place, you have your ups and downs, but I think for the most part, ChesPenn, we do our best, and we want to make sure we always strive to do our best, and we give quality health care to our patients that's respectful. And if we get it wrong one day, let us know, and we'll do whatever we can do to correct it and make it right, because we want everyone to be felt valued and respected.
That's awesome. Open door policy.
Yes, open door.
Come and talk to Miss Sue. She'll handle it.
Yes. And one of our office, our director of operations, who's works out of our East Side office, her name is Alida Marquez.
Okay.
So her and then any of our staff that works at the front desk, feel free to say, you know what, I heard Sue said for me to come in to make an appointment. Or Sue said, we can walk in for an STD. Yes, Sue said that, so they can come on in.
Well, y'all stop past ChesPenn, come and see Miss Sue and her staff, and they're going to take care of you guys.
Most definitely. Thank you so much.
You're welcome. Thank you for coming today.
Thank you.